Strait Islanders and Aboriginal people are incredibly rich and diverse in culture. They are one of the oldest cultural groups globally who still have huge connections to water and their land. And we are incredibly lucky to be able to work with them up here.
Kapukut muzinel noma ngai gamuleg atlak ni tumunai wal manin muzulaga kay meso.
We've got 4 different clusters in the Torres Straits. We've got Near Western. Near Western speak the Kalalagawya. In the Top Western, they speak Kalakawawya. Central Islands speak Pulkawya, and Eastern Islanders speak the Miriam-Mer language. Together, everyone speaks the Torres Strait Creole, which is broken English. So English comes in as the third language for our clients and for our communities in the Torres.
I love my job because I get to empower First Nations healthcare workers, make a difference in their community, and by me leading a team of nurses professionally, we can make a difference in closing the gap in the long term.
The thing that I really love about working in the Torres and Cape is my interaction with the community members, being able to know them on a professional and personal level, and being able to build a strong rapport.
The clinical skills and the diversity in the nursing up here is really amazing and something you don't see everywhere in the world. The sorts of things that walk in the door is not like the things I've seen anywhere else. So yeah, really that the range in health presentations, and also trying to give back to the community here, like you know, trying to help close the gap and trying to help really improve the health of Indigenous Australians.
Yeah, you can just concentrate on, empowering the health workers, clinical training, being that liaison and the advocate really for the people in the community.
I think more in a metro setting, the day is quite structured and you know what to expect, but here anything could come through the door. So your day could start off with taking a helicopter out to an outer island, flying over dugongs, flying over turtles, and then being able to land and just have a day out in the community, being able to really work with the primary care teams on the island to be able to provide really personalised service to the community as part of a multidisciplinary team.
So many unique opportunities here. I mean, the things that walk through the door, the autonomy that you have, it's very much you need to work with what you have. You might not have everything that you'd have down south to maybe treat something or to provide to someone, but you need to be really skilled at finding what you have in the clinic and in the community resources, and thinking outside of the square to really provide that good healthcare for them.
Yeah, so we have a small team, but we try to do the best we can with what resources we have, from human resources to whatever equipments and stuff that we have. So we do try our best.
The entire gambit of nursing, as I said, from prenatal care all the way through to palliative care and providing that emergency response. That sort of work on a single nurse post with your Indigenous health workers is phenomenal, because you never know what's coming through the door next. It could be a childhood vaccination, then to a yarn with someone about their diabetes, or working through end-of-life care with family. And that sort of experience you can't get anywhere else.
So, as a remote midwife, you become a jack of all trades. Your scope of practice as a clinical midwife definitely increases. Within tertiary facilities and metropolitan hospitals, we don't have the ability to work across the full scope and continuum. In remote settings, we work with extreme pretermers as well as post-dates, as well as complex medical needs for women. And that's not something that all midwives get to do. It's something that you get to do in a rural setting.
When I'm not working here, we're generally at the beach. 2 young kids, so yeah, we're always out at the beach, fishing, camping, out on the motorbikes and out on the boat.
Passions outside of work. I'm obviously quite skinny, so I run, fishing, reading and also studying. The more study, the better.
You can walk around Warraba in 45 minutes. It's only 3 kilometres. And on the way you meet people and you stop and you talk to the kids and stuff, and you can easily spend hours down at the beach.
My favourite thing to do is walk down by the beach. I also love to go fishing, I love the boat rides, and I love enjoying the sunsets and enjoying the view. I can't believe I live in this beautiful place that I now call home.
There's so many unique opportunities up here, like helicopter rides and boat tours and little cultural things that you can do. The cultural centre, it's all so fun, and there's still so much to see, and I've been here for 3 months, so.
Probably the isolation. I can see some people might find it a little bit daunting. I mean, we're in the middle of the Coral Sea, and it can be a little bit overwhelming, but there's 4G out here. You can watch your Netflix, you can, I don't know, do your knitting tutorials or whatever.
Some of the definite immediate challenges is the isolation, and the fact that if you want to go anywhere, you have to get on a boat and a plane to go anywhere. But then that's half the fun of being in a remote area.
You are, yes, isolated, but the island becomes your family.
I think the isolation part of it is really challenging. Not being able to go to Woolies or anything like that is a little bit hard, but I think once you've been here for a while, you sort of assimilate and it just becomes a little bit easier, but I think that's probably the biggest challenge.
One of the things I think for midwives and nurses to know about the Torres Straits too is that we have a really big kinship system. So whether it's through blood ties, all our traditional practices like traditional adoption and all that sort of stuff. So everybody knows everybody in the Torres Strait.
Very beautiful people here. The people are very quiet, shy, but are very respectful, and anybody that comes here will just get along with them. People have come here and have never moved away. They've come here, they've married, they've stayed here, or they go and they always come back.
The people are just so beautiful. They're genuinely good people. It's a safe place to live. It's a great place to bring up children. Yeah, we've stayed here for the lifestyle. Look at where we live. We walk out of work and we're on the beach. So we sit here and have our lunch break on the beach. It's just amazing.
It's like being on a school camp. Your friends are just here all the time. You see them every day. It's so nice. People just wander in and out. You're all part of a little family. It's so beautiful.
The hospital really requires nursing staff who have got critical care. Certainly ALS is a major requirement. Renal qualifications, midwifery, and certainly theatre as well.
Well, for me, I would love to have a nurse that is emergency, knows emergency, and also that a great personality, really, and and able to a good clinician, and then the other things we can work on.
Key personality traits are resilience, both personally and professionally. Also, open-mindedness is being open to a challenge and being open to anything that can come your way.
We are so fortunate in the Torres Strait having a model of care that is led by our Indigenous health worker cohort, and it strengthens the way that we engage with our community, and we can have that culturally safe service delivery. So as a clinician coming into our region, it's really important to make sure that you acknowledge that this model is in place for a reason. It's for the care and the safety of our community.
In our communities in the north, where we have clinical nurse consultants, we have Indigenous health workers that work alongside with them in the clinic and also outside in the community when we're doing home visits. This is just to ensure that any information, clinical information that is passed down to our clients are understood by the clients, because English is the third language that is spoken here in the Torres Strait.
Working closely with your Indigenous health workers and your health centre managers is key to actually closing the gap. If the model of care that we provide up here is fantastic because it's health prevention and promotion and not reactive medicine. And by engaging with your Indigenous health workers who do an amazing job, they then in turn engage with community and we can start getting health checks, getting all those things sorted out, so then we don't have the chronic condition burden in the long term.
Torres Strait Islander peoples are probably the people that you want to work with as a midwife. They teach us more than what we teach them. They're the women who have birthed babies on country for thousands of years without intervention from westernised medicine, and they are incredibly humble women, and their families and their stories are just so rich and diverse.
We really appreciate. They come in community, they bring something to come in the ward, they teach us, and we teach them back our culture. They teach us the way, because when they come, they bring their culture with them, and the two cultures are mixed. It's beautiful.
Try and find yourself a mentor within the health stream and outside of the health stream to be able to help you govern your way through community and all of the aspects of cultural sensitivities that needs to be considered when you are coming into our region.
When I was new onto the island here at Mobiag, I utilised my health centre manager, Norma. She was amazing and introduced me to some cultural mentors on the island, where I then engaged with the men's group, the ladies group, and just assimilating and becoming a part of the community in a culturally appropriate way. I then gained respect.
There is always someone there to work alongside with the nurses or the health workers.
Come with an open mind and come up, because it's life-changing. It changed my life, and yeah, it will continue to change my life.
Yeah, come in with an open mind. It's an amazing opportunity, beautiful place to work and beautiful people. Yeah, if it's something that interests you, then absolutely go for it.
Yes, and it's like one big family, and you can go anyway.
If you've got the opportunity to come up and experience this, you know, provided you've got the right skill sets and the like previous knowledge that you can apply to these communities, yeah, it's well worth the adventure.
Because just the life-work balance, the interest of the job and the colleagues are just amazing, so it keeps us here in the area.
I think it's the best decision I've ever made in my life, and coming up here I've learned so much about the culture and I've met so many family members, and it's only been a year, so I just say go for it.
Within the first week of arriving, I met my best friend. We just have the best life. I was like, we're actually not going to leave here. Like, it's so good. And that's the truth. Yeah, we love it so much.
Auntie Margie has birthed babies of babies of babies here, and she knows the language, she knows the culture, she understands some of the social determinants, especially within particular family groups or island groups.
We followed the mom as the journey started. We were there when we first hear the heartbeat, and we were there when we listened to the first cry. And it was a miracle. Like, we didn't see in their belly, like they got a scan now. Everything we do before is we're doing with our hands. We feel the mommy tummy. We feel how big is the baby. And that's the hand that we held to deliver the baby to come out. And I find it is a miracle.